Do you feel like you don't belong in medicine? Like there are so many people doing amazing things, and you think, I could never do that. If you have ever found yourself holding back because you think you don't bring anything unique to the table, if you've ever felt intimidated by all the amazing people around you and decided not to push on and put yourself out there, know that you are not alone, and this episode is for you. Welcome to the MedEdWell Podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stegink, a practicing general pediatrician and online entrepreneur. Welcome to this, the 7th episode of the MedEdWell Podcast. It's hard to believe I've been at this for almost 2 months now, and I am so thankful for your engagement, for your support and encouragement. It has been so good for me to know that this is already making a difference for other physicians. Today, we will talk about imposter syndrome, something that has a big impact on wellness, particularly with mindset. It encompasses the thoughts that hold each of us back when we get that feeling of inadequacy, looking at the achievements of those around us, or the perceptions or assumptions we hold about how difficult a certain task or challenge will be. Today, I will show you the 3 things that you need to know about dealing with and defeating imposter syndrome when you see it pop up in your life. But before we get into the rest of today's episode, let's hear from today's sponsor. Getting a financial education seems daunting until you realize that you did way harder things in medical training. The White Coat Investor has been promoting financial literacy for doctors since 2011 and has great courses to help you make a financial plan, evaluate financial advice, and pursue your wellness. CME is included on some of the courses, making them a perfect fit for those unused professional funds. I have personally taken the Fire Your Financial Advisor course and found it super valuable in my own financial education. I encourage you to visit the link in the show notes and consider signing up for a White Coat Investor course today. And now, back to today's show. Did you know that for the 2020 academic year, there were 53,000 applicants to U.S. medical schools? Together, they submitted over 900,000 applications. And yet, despite submitting an average of 17 applications apiece, less than half of those applicants, 42%, were accepted and matriculated. Wow, that's a lot of applications. It has gotten even more competitive than when I was applying for medical school, so there must be even more qualified candidates out there every day. With that background, we'll pick up my story as I left college, graduating summa cum laude from a small liberal arts college with a bachelor's of science in physics. From being in the top part of my class in a school of about 3,000 undergraduates to a medical school with a first-year class of nearly 200. I had never had a lecture class that large, ever, in college. Maybe freshman biology had 75 or so students, maybe a little more. But that was it. In college, I was a big fish in a small pond. I benefited from small classes, more opportunities to ask questions, get mentoring. Yes, being a physics major and pre-med was out of the ordinary. I show up in medical school and find out, wow, I thought I was pretty smart. But these classmates of mine, they are super smart. Some had prior graduate degrees in chemistry, work experience outside of medicine, prior research, or plans for research on their way to whatever specialty they had their mind set on. It was a bit intimidating. So I'm not the top of my class anymore, but I'm still pretty good, right? And then the classes come: anatomy, biochemistry, physiology, histology. Some of these things were covered extensively for my classmates in undergrad, and others were just smarter than me. I get a failing grade on my first exam for histology. Do I really belong here? I was used to working hard. I was a learner. And yet, wow, am I really cut out for this? Let's stop for a moment and identify what's going on here. This comparison game that had me stuck, questioning myself, my journey in medicine, before it had barely begun. I felt like an imposter. Feeling that I don't measure up, that I'm not good enough, letting that hold me back. These are all components of how imposter syndrome showed up in my life. Today I'm going to show you the 3 things that you need to do to fight imposter syndrome. It will likely pop up in your life as a physician if it hasn't already. And then before we end here, I will leave you with a vision of what your next step forward could look like in your life. First, you need to identify that you might be facing imposter syndrome. Those feelings of paralysis, I can't do this, I can't apply for this. I wondered, after I failed that first histology exam, am I really cut out for this? Was it a mistake to do physics in undergrad, which I enjoyed? Should I have done biology like I was, quote, supposed to? You need to know that this is a common experience in medicine. I faced some of those thoughts again as my USMLE Step 1 score was average or slightly above it, but not much. Will I be able to get into a good residency program? I was already leaning towards pediatrics, combined internal medicine pediatrics, or family medicine. I knew that I didn't need scores as high as I would need to apply for ophthalmology or some other competitive specialty, but even though I knew I had done my best, it was still intimidating to hear my classmates say, "Oh yeah, I got this score on Step 1, and now I want to apply for this prestigious residency or this higher-paying, cool specialty." It doesn't just stop there. Imposter syndrome also cropped up in residency when I applied for one of the 3 chief resident positions during the middle of my second year. While not the most gifted teacher, I am good with details, spreadsheets, and logistics. I saw this as an opportunity to grow in leadership, and I thought I brought sufficiently different skills, particularly on the administrative side, when I saw the things that at the time didn't make sense, particularly about scheduling. And yet, I didn't get one of those 3 positions. I was definitely bummed at first, like I had missed out, that I wasn't what the program leadership was looking for. I know it's not just me. Whether it's saying, "Oh, I'm just specializing in pediatrics, not med-peds or something else." Whether I'm just the medical student, or just the intern. It could be, well, I'm not going to be as good of a doctor because my clinical experiences were more virtual than in person because of COVID. Whether you have considered applying for a leadership position, considered starting a new clinical program, writing a particular paper, or something else, there is always someone out there that you could compare yourself to. Just realize that when these thoughts come up and you start to feel like, I can't do what so-and-so person does, you could be experiencing imposter syndrome. Great. So now I'm an imposter. I feel like I can't do this. It can show up differently for different people. So naturally, what will you need to rehearse in your mind? What will you need to keep telling yourself over and over again? This too will be different. So what am I going to keep on the top of my mind? 2 things. Number 1 thing to rehearse. Keep telling yourself positive, meaningful things. This could be starting a gratitude journal and adding a few things every day. This could be reflecting on prior positive feedback from attendings, from patient families, or from loved ones or friends that have encouraged you in the past. This could be about things inside or outside medicine, opportunities you have taken to care for others and be involved in their lives. Even writing those things down, or keeping a few cards or notes that people have written you. These can be helpful things in reminding you of your impact on other people and how they care about you. It could also be a positive thought or a favorite quote from a particular author, a song, a mantra, or a religious text that is meaningful to you. For me, the wisdom sayings of King Solomon of Israel in the 10th century BC are valuable to me. As I went into my USMLE board exams, I kept holding on to one of these sayings: "The horse is made ready for the day of battle, but victory rests with the Lord." In other words, I can do all I need to prepare, and yet I can't control the outcome. I have to trust in something or someone outside myself that things will work out one way or another. It's that illusion of control again. In addition to what you tell yourself and keep on the forefront of your mind, the second thing is to rehearse the positive or helpful input that you get from family, friends, or colleagues in your life who encourage and support you. You may need to let them in on some of the struggles you have, some of which may be universal, and some of which are unique to medicine. Medicine is a beautiful privilege and a calling for many, but it is a hard road at many points along the way. People who know you and can help keep you grounded encouraged, and supported are so important, since we were not meant to do this life all on our own. That community is so important. Imposter syndrome is super common, especially as we come up on new challenges, new chapters in our medical careers, whether from medical school to residency, becoming an attending, versus trying to add a particular other clinical opportunity. Those seemingly insurmountable obstacles, the thing you didn't think you could do. Was it simply because you were intimidated, or is there something actually to learn from it? So when you're facing imposter syndrome, first, you have to identify that it's there, that you're facing it. Number 2, you have to rehearse some of those positive thoughts and make sure you have people in your life who are encouraging you along the way. But number 3, it may be that you need to evaluate, hey, where do I need to grow so that we could take that next step forward? It could be a gap in skills or knowledge where you could actually get equipped, whether an additional training, coaching, or something else to close that gap in your ability to accomplish the goal. Imposter syndrome shows up a lot of times when the only gap is your mindset. That feeling like, I can't do it, when in reality, maybe you could. I've heard this from medical students who are dealing with imposter syndrome, being 3rd and 4th year medical students in the midst of a pandemic, with many experiences truncated or shifted all virtual. Yes, there are gaps in your clinical skills. And yes, you will need to seek out feedback and opportunities to address some of those things you missed. But this doesn't mean that you won't be a good doctor. On the contrary, if you take that gap and then rehearse those positive thoughts from before, you can encourage yourself that you are a learner. You are a hard worker. You never give up. And you are committed to getting what you need to progress in medicine. So take a moment and reflect on how you need to put these things into practice, to step forward, to take that next step, to go do that hard thing, to try something new, to apply for that leadership position. Take confidence in who you are as a great physician, or soon-to-be physician for all you medical students out there. Now, take a moment and imagine how your life will look in 6 months if you put some of these things into practice. You won't say, I'm just pediatrics. No, I'm categorical pediatrics, or specializing in general pediatrics, full stop. I'm not just Ryan, or I am just the medical student. Hi, my name's Ryan, and I'm a 4th year medical student on your medical team. Hi, I'm Dr. Stegink, the 1st year resident or intern. However you want to say these things, owning these things can make a big difference in your mindset, how you see yourself, but also how you communicate that confidence, not in a brash, demeaning way, but in a way that draws the patient or family in, helping them feel, this is my doctor. This medical student is really part of my medical team, and I can trust them. You won't think that just because you haven't done something and someone else has means you can't. Each of those individuals were once there as well, not yet having done whatever amazing thing they do now. You could be the next physician coaching other doctors on how to start and grow profitable businesses. You could be a physician coaching your patients on weight loss and wellness with amazing results. You could be branching out with your own private allergy practice and having a full schedule quickly so that you can serve your patients. This is not to tempt you to play the comparison game again, but to imagine what is possible. To recap, first, you need to identify that you are facing imposter syndrome, rehearse those encouraging thoughts and words from important people in your life, and then evaluate where you may still need to grow. But then go do it. That thing that you've been waiting for, dreaming of, that thing that can help you make a difference for your patients, your career, your community. Take that next step in your wellness journey, even when imposter syndrome lurks around the corner. Go for it, and then share your wins with someone else to spur them on in their journey. Thank you so much for joining me for another episode of the MedEdWell Podcast. Please subscribe and share the podcast if you haven't already, and leave a review. If you need help making a financial plan for yourself, or need somewhere to use your CME money this year on further education around financial literacy and wellness, check out the online courses available at the White Coat Investor. Just click the link in the show notes. Please come back and join me for future episodes of the MedEdWell Podcast, and have a great day. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell Podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell Podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell Podcast, and have a great day.